focus on lymphocytes and dendritic cells in immunotherapy. Okay, so this is about the two different blood samples taken today. This morning were about CBC and metabolic panel. The laboratory, the immunology laboratory, they are working with these different products with a big sample, activate the lymphocytes with the natural killer cells. They come together for Thursday morning, the blood infusion. Dendritic cells is about two different injections. The first one will be here Friday, and the second one finishing this therapy in Santa Barbara, maybe arriving home. And the protein solutions is about cytokines, or instead of this we can use the cholecystoxins. This to use every 2 weeks for the next 5, maybe 6 months.
That's what I'm going to use.
Yes. And there is a report about the number of circulating tumor cells that comes next week, so we can share with you this information by email. And this is important to know about the malignant activity of the tumor now, how many cells are in the blood, and compare in the future after some months of therapy. Okay. Now, this is a picture of blood under microscope, just to know some of these purple cells are white cells or immune cells. The most important for us now are monocytes, the lymphocytes or T cells, also known T cells, and natural killer cells. Some other cells, circulating tumor cells, come from tumor mass. Depends of the malignant activity of cancer, the circulating tumor cells number. Okay, monocytes, they need to be stimulated with this cytokine, interleukin-4, to become as dendritic cells. Dendritic cells are the active form from these monocytes, and they are able to catch cancer cells. Catching these cancer cells, they are going to recognize all the antigens in the surface of these membranes, and it's important to get this information to share with lymphocytes and natural killer cells. So dendritic cell presents antigens to lymphocytes and natural killer cells in the lymph nodes around the body and all the lymph nodes. Dendritic cells have the information as the generals in the army have enemies information to share to the soldiers. Okay. Previously, these lymphocytes and natural killer cells, they were activated using this interleukin-2, that's the most important, interleukin-15 for natural killer cells. And after this activation, and after getting these antigens from dendritic cells, they are ready to seek and destroy the tumor mass. So this process is lasts around 2 weeks. 2 weeks fighting against cancer cells. And after that time, after 2 weeks, it's important to remind the immune system how to keep working, keep fighting, using interleukin-2, interferon alpha, tumoral necrosis factor alpha to enhance the power again. Cytokines produce the most of the flu-like symptoms, the tiredness, fever, headaches. That's the most common.
That's the Cooley's vaccine.
And instead of this, we're going to use the cholestoxin. Cholestoxin are about fragments of dead bacteria, and the reaction of the immune system is to release to the blood cytokines, producing these symptoms, the fever or fatigue. And in that moment, lymphocytes and natural killer cells focus against malignant cells. So that fight shows the result in around 8 weeks to see how the tumor mass is shrinking or the number of circulating tumor cells are decreasing. And then the aim is to stop the malignant activity, and we recommend to check again with a new CT scan or the CTC, the
Circulating tumor cells.
exactly that count, or tumor markers too. So the therapy about hospital stay is using the activated lymphocytes and natural killer cells infusion. The next day we can use dendritic cells. This is about subcutaneous injections in the thigh area, near of the lymph nodes, in the pelvic and abdominal area. At home, after Santa Barbara therapy, is about the second dendritic cells injection in the other thigh. And 2 weeks after this shot, the protein solutions, the cholestoxin in this case, to use every 2 weeks, using in the deltoid area, intramuscular injection, for the next 6 months. And we need to be in contact all this time by Dr. Arce's email to know about your questions, to know about your new records, or any